Dr. Rutuja from Parency IVF Hospital. Nowadays, it is a trend. People are talking about when and how I can freeze my eggs, or oocyte freezing, or we also call it in medical terms oocyte cryopreservation. So, what is this egg freezing or oocyte cryopreservation? Let us talk in detail about it today. So, egg preservation or fertility preservation or oocyte cryopreservation means we freeze your eggs for unlimited time till you are ready to have babies of your own or when you wish to become a mother. Egg freezing or cryopreservation will help you buy time to become mother if you are not ready to become mother today. So, how to do it, what to do it, what is the process, we will talk about it. What is the ideal age to do egg freezing? Ideal age to do egg freezing is before 30 years of age. You can do it from 25 years also. But can you do egg freezing at the age of 35? Yes, you can do egg freezing whenever you want, but your AMH should be fine. That means you should not be into perimenopausal time or into a phase of premature ovarian failure. Before that, ideally before 35, you should cryopreserve your eggs if you are looking for doing so. Then next most commonly asked question to me by a lot of people is the procedure very cumbersome? No, the procedure is not very cumbersome, but yes, you will have to take a lot of injections. So how is the process of egg freezing? It starts with consulting your infertility or fertility expert to understand how much is the fertility window available for you from the day you came for consultation. They will run you through few blood tests, there will be an ultrasound scan, and then they will plan that whether you can go ahead with egg freezing or you cannot. Once the doctor says that you are fit to go through this process, the next visit will be on the day 2 of your periods or menses. From this day, you will be put under few injections every day for next 10 to 8 days. That is, you will be put through few injections every day for next 9 to 10 days. During these injections, in between there will be few scans to monitor the growth of your eggs. Once your egg size reaches 18 to 20 mm of diameter, there will be a trigger injection given. Once the trigger is given, exactly post 36 hours post trigger injection, you will be posted for the third phase of your process, that is ovum pickup or oocyte collection time. This is done under anesthesia. There is no cut or stitch given, with a small short general anesthesia of 10 to 15 minutes through a transvaginal ultrasound method with a small 22 gauge needle. We will aspirate all these oocytes out. Once this oocyte is aspirated, embryologists will screen the fluid and collect all the eggs which have been retrieved. Out of these eggs which are mature M2 or properly matured eggs will be frozen in various vials depending on the number of eggs retrieved. These eggs can be frozen for 5 to 10 years and for a longer period of time also. But since egg freezing has been started very recently, we don't have lot of data beyond 10 years, but we have seen babies being born from eggs who were cryopreserved for 10 years and above. So you can freeze your eggs till 10 years of age. Next most commonly asked question is, doctor, can all these eggs survive when you thaw and try to form babies? Yes, or almost 70 to 80% of these eggs should survive the thawing procedure. But unlike embryos which survives 100%, oocyte survivability is slightly less than the embryos. But the live birth rate and in-hand pregnancy rates are almost similar than any other IVF procedure done as a couple with an embryo. Another question very commonly asked is egg freezing very expensive? No, according to the time and the freedom which it gives to all the women around, it is not as costly as it sounds. So in Indian setup, if you go for egg freezing, depending on center to center, depending on your health, your cost of egg freezing can last between 80,000 to 1.2 lakh rupees. And yes, every year there will be a freezing cost of your eggs. So every year you have to pay certain renewal fee to maintain your eggs to be frozen. So if you want to freeze for 3 years, you have to give every 3 years. If you want to freeze for 5 years, you have to give it every 5 years. This is the process of egg freezing.